I won't assume that all of you know me. My name is Ravi Philemon. I'm a member of National Solidarity Party. I want to thank TOC for organizing this forum because for two reasons. One is it allowed the party to reflect on its past policies on healthcare and how relevant it had been for the Singapore scene. And there are three proposals, past proposals by NSP which have been adopted by the government. Namely, we asked that there be an increase in healthcare spending to build 4 more new hospitals over the next 5 years to increase the total number of hospital beds by 20%. The second one being make mandatory a comprehensive medical insurance scheme which would cover healthcare needs of all citizens, including the needs of children with pre-existing medical conditions, with the MediShield Life that has been adopted as well. We've also asked that outpatient treatments be covered at private medical clinics. With the outpatient subsidy scheme CHAS, the government has partially accepted this proposal as well. The second reason why we want to thank TOC for organizing this forum is because it helped us to think through what our own philosophy is, the party's own philosophy is when it comes to healthcare. And this is NSP's philosophy. For NSP, our guiding philosophy on healthcare is a simple one and is centered on the well-being of citizens at the core. Both citizens and the government have a joint responsibility for the healthcare needs of the individual. We believe that citizens need to have peace of mind and be assured of the availability of good quality, affordable and adequate healthcare regardless of their status or wealth. On the principle of co-payment, we believe that while the principle of co-payment is sound, it is as it ensures that there is no unnecessary overconsumption. It discourages overconsultation and ensures some cost recovery. It is important to ensure that citizens are not deprived of medically necessary care and are not unnecessarily encumbered with medical debts. To mitigate concerns of moral hazards, as well as to ensure that those that need necessary medical care are not deprived of it, NSP proposes differentiated co-payment quantum for different types of healthcare needs. On preventive care, the principle of co-payment, we believe, should not be applied to prophylactic healthcare measures. One doctor I spoke to recently said that half of the population of people who have diabetes don't even know that they have diabetes. We need to remove co-payment so as to incentivize citizens to use preventive care services like mammogram, pap smears, blood tests, ECG, etc. Mr. Koh-Boon-Wan, the former health minister, said in 2006, one way to improve healthcare delivery is greater integration where family doctors have to play a bigger role to manage illnesses like diabetes, high blood pressure, and stroke, so that there is no need for expensive hospital board specialist treatment. We believe that we should incentivize doctors who provide primary care to encourage their patients to go for preventive screening. Earlier disease detected can prevent a lot of costly medical expenditures later. So we believe in providing free periodical basic medical checkups for all citizens at public polyclinics without means testing to encourage all citizens to live a healthier life, and early detection of illnesses which will require high health expenses if it is detected early. For primary preventive care, we also believe that there is a need to revisit the fee guideline removed by SMA because of the Competition Act. For acute ambulatory care, we believe that the principle of co-payment applies more to this type of care, as co-payment will ensure that such scarce services will not be overconsumed and to mitigate concerns of moral hazard. For long-term care, the party believes that Medisave and ElderShield may be insufficient to meet senior citizens' long-term care needs, especially women, as it is unfunded self-insurance scheme. We believe that top-up of Medisave accounts has got to be allowed by immediate family members, including husbands to wife, by removing the age restriction on Medisave top-up, to provide tax reliefs for such top-ups. We believe additional top-up schemes to Medisave from government to citizens who are homemakers and caregivers. We propose providing mandatory enrollment to ElderShield and to lift the entry age to ElderShield, now set at 40, to encourage preparation for old age at an early stage. Premiums for this revamp may be means tested, with lower income individuals, homemakers and caregivers paying lesser premiums. And we also propose allowing citizens to contribute, funding these Medisave accounts beyond the cap, now set at 43,500. When it comes to palliative care, the withdrawal limit for home palliative care, now set at 1,500 per patient per lifetime. We propose that this limit be lifted and a higher withdrawal limit be set. We propose that the foreign domestic worker levy for foreign domestic workers who are employed in palliative care be removed. We propose the removal of co-payment for non-clinical services at center-based palliative care for all citizens, and to train more professionals for geriatric and palliative care. A very important proposal, a very important revamp that is now going on is the revamp of the MediShield to MediShield Life, and how healthcare is approved, how healthcare is looked at in this country. And an important legislation, and when you look at the future of healthcare expenditure in Singapore, it looks very murky, especially with things like the Trans-Pacific Partnership and their patent on surgical procedures. And how will it affect the MediShield Life premiums in the future? This is something that you should lobby your ministers, your MPs to ask this question. So the government is going to implement MediShield Life and has said that premiums will be affordable. But there are concerns as to what affordable means. How are citizens whose Medisave accounts have been depleted going to pay for the premiums for the MediShield Life? As a policy, NSP supports top loading of premiums for MediShield Life. Younger citizens will get old eventually, and they are going to pay it forward for their own future. The government should also co-pay a portion of MediShield Life premiums for all citizens. When the scheme is implemented, the government should provide a one-off special top-up for premium funds top-up to the premium fund to cover citizens with pre-existing illnesses, so as not to shift the financial burden onto healthy citizens. Finally, other concerns. We are concerned that the government should also increase spending on mental health care services, and NSP asks the government to be more transparent on the eligibility criteria for the usage of MediFund. Thank you.